Good evening, everyone. This is my presentation for session 4 for analysis, concepts, presentation, and discussion. My name is Connie Holland, and this is for strategies in healthcare administration, economics, and finance. Okay, the first thing we're going to talk about is trend analysis. I do not know who this young lady is in this picture, but it is not me. As you can see, I look nothing like her. The first thing we're going to discuss is what trend analysis is. One of the biggest things that it's used for is to forecast future medical costs. So mostly when people think of trend analysis, they're going to think of crunching the numbers as far as how much is going to be spent in the future based off of what was spent in the past. So you're going to be looking at the previous year's cost, and it can predict your future costs. It's easier usually to do 1 year at a time based off the trend analysis. It usually can be more accurate, but eventually you're going to have to do a forecast or a budget based off of 2 or 3 years ahead. And this at this moment is when you're going to need more information in order to be able to do a more accurate budget or be able to project into the future what your spending is going to be for your organization. It also compares figures over several periods of time. Like I said, you can do 1 year at a time, but it probably wouldn't give you the best accurate analysis of a projection ahead. You need to look at previous years. It's also important to look at information or things that could have happened during a period of time that might have changed the numbers. So this is why we'll talk about this later on in the presentation about where you get your information on to do the budgets and the cost analysis, because you're not just going to use the uh, previous statements. You're going to also go to other sources to get your information so you can make the most accurate budget or cost analysis. Um, it also can be utilized to compare all types of information to improve performance. You can look at trend analysis for even looking at mistakes that someone has made. If you see that there's always, for example, I work in the laboratory, if we notice that there's a lot of missed tests for a particular doctor, or if a patient is always, or a tech is actually always having to delete their results. You can look at that and use that as a trend analysis to be able to make projections on how we need to make a corrective action. So trend analysis doesn't have to be utilized just for budgets. It can be utilized for a whole, it's definitely a resourceful tool to look at how to uh, be utilized for performance improvement. It gives you the what, but not the why. So this is why I was talking about earlier too, about how you got to get more information than just off of the reports, because all that's going to tell you is what is going on. So we're going down in our numbers. We're having less patients, or we're using less supplies, or we're using more supplies, but it doesn't tell you why. So that's when you have to get to the root of the reason why, so you can make better projections for your future. Um, I gave an example of trend analysis. You could utilize that in a laboratory for looking at maybe adding additional space for your laboratory, or for even adding staff. You can look at what the projection of our previous results of how many patients were seen the previous year or the year before, and what was the growth, the amount of growth, or how much it was the patient increase from 1 year to the next. So then you could kind of get a good idea of how many more patients will be seen in the following years, and how much growth you're going to have in the lab, which would warrant you having more capacity, or having more room in your laboratory, which would include maybe possibly also having additional staffing. So there's lots of areas that trend analysis can be utilized. And that was one small example of how it can be used. So it's not just a tool for budgeting, or for numbers, or for projecting into the future of how much revenue is going to be utilized within your organization. The next area we're going to talk about is comparative analysis. Um, the first thing that I think of when I think about a comparative analysis is I think about comparing yourself to one organization or another organization. So it is used for that, but a lot of times managers are just going to use it within their organization themselves, inside their organization. For example, in my organization, I could compare we have 10 clinics within our organization, probably more than that. I'd have to sit here and count. But we have laboratories within each one of those organizations. And then when it comes to capacity or the amount of patients seen, I could look at the amount of staff that I have per those patients, and I could also look at the other clinics to be able to do a comparison. Okay, this clinic or this lab has 3 personnel and this amount of space to be able to do their job, but the other clinic doesn't have. So I could do a comparison study between the laboratories and the clinics, and this is also very beneficial as well. But one of the biggest things with comparative analysis is that it creates, like it says here, a common ground to make judgments for planning. So when you have a group of people, a lot of times they might have varying opinions on what needs to be done or how to move forward with a plan, but it's usually based off of their perspective or what area they may work in. But when you have numbers or when you have information based off of something that may have happened in the past or information that has been reported or data, then it's something that everyone in the planning process can agree on because it's concrete. It's right there in front of your face. It's numbers, and most of the time, numbers don't lie. You can look and see, yes, we've increased our patient workload by this so many years each year, and we know that we're going to have to make some changes in accordance with that. So that's something that everybody can agree on. It's a foundation to move forward with whatever project you're going to do and be able to analyze your situation or your budget for the future. Um, and like I said in the second statement here, it says that it's used to compare data within the organization, but it can also be useful to compare against other organizations as well. It's always good idea to look at other organizations whenever you're trying to establish your budget, because you could see always benefit from the numbers if you can get those numbers to make improvements within your organization. Okay, now we're going to discuss some of the benefits that are associated with the three different sources of information for forecast. I kind of touched on them earlier in this presentation, but there's three levels. We have a first level, which is directly involved in the department. That's where you're going to get your information and find out what might have been going on when there might have been a dip in the amount of number of patients or whatever information you're looking for. Because if you go to your electronic reports, they're not going to be able to give you a vivid view of what was going on at the time. Certain numbers might have been different or not look right on your reports. So that's going to be a benefit to having those members directly that are directly involved in the department that you're trying to set up a budget or cost analysis for. So because they know what was going on, they know sometimes a budget can look right, but you don't know if your department was going without. Yes, they maybe made it by on that certain amount of money to buy supplies, but what were they doing? Was somebody buying their own supplies, or were they bringing stuff in? Were they doing without or trying to improvise? So there may be needs there, and by going directly to the department itself, you can get that information. Um, on the second level, you have your electronic reports. We already discussed that. What's great about this gives the foundation for everyone for something them to all agree on. It gets the planning process started on something that's concrete, something that everybody can believe, that something that everybody can agree on, and you can work from there, establishing your cost analysis or your budget for your organization. Your third level, which is the benefits of having your third level in that, is it's going to be your executive level judgment. There they can see the big picture. They see everything for the most part that's going on and going in and out, and they understand why something can be done and why it can't. Why can't we buy this, or it has to be under a certain contract, or why can't we get funds from this, and this is why we can't do this. They're more involved with logistics. They might also be involved with regulations. They know the policies and the procedures that have to be followed, and the reason why things can't be done a certain way. So they're going to be your guidance and your policies and your guidelines and your state and federal regulations. So they're very important, and that's the benefit to them being involved in the process. Okay, this slide is going to be about the challenges from these different levels when it comes to forecasting. Uh, I've already kind of touched on some of these in the previous slides, but once again, we're going to talk about the direct involved in the department. Yes, while they might be able to give us information that in need of, they really don't have an idea of what goes on at the executive level, and they may not know the regulations and the policies that are involved in the whole process. So they're only seeing their view as a department view. So they might not have a good idea of what's going on. The second level, once again, the electronic reports, it gives you the information. It just doesn't tell you why. So that's why you have to go back to your first level to be able to get that information. And it gives you the numbers, but it doesn't give you the information on why those numbers are the way they are. And then once again, the third level, executive level judgment, sometimes there is all pretty much intertwined, as you could see, because the third level doesn't know what the first level is going on most often, because they may not know that for a period of 3 or 4 months that department was getting by with minimal supplies, but all they see is the fact that they were getting it done. They were getting the patient care taken care of, but they were utilizing whatever means possible to take care of the patients because they didn't have the money or the budget to be able to buy the supplies or the things they need. All they see is that, yes, this department made it happen. We got the patients taken care of. So that would be a challenge for the third level. So all of these that's why it's so important for all of these to be involved when it comes to forecasting, to be able to forecast to the best, to get the best forecast of what the budget's going to be and what will be needed for the upcoming time periods or years for the organization. The impact of assumptions. So your assumptions are going to decide the expected future business conditions that drive the forecast of the company's balance sheet. So there are going to be assumptions that are going to have to be made. But that's going to be assumptions are going to be made off the information received by the different levels that are going to be forecasting the information. So all this comes together, and assumptions will be made. And assumptions can also be revamped, or they can go and be changed. So it's important when assumption is made that you provide what information it was based off of. So if you make an assumption based off of a trend analysis that you saw off a financial report from the previous year, you want to put your assumption, and you need to know what it was based off of. It's not just something that it just looks like this is where we're going to be or what we need to do. You need to have your evidence, or why this assumption is being made next to it. So when you go back, you know why we forecasted this for our cash flow or for our balance sheet based off of this assumption, and the assumption was based off of this information. Anytime we're doing a cash flow analysis or budget analysis for organization, we need to have an understanding of our capacity. In the manufacturing industry, capacity is related to the production of a product. But in healthcare, we do not provide a product. Our product is our services. So when we are doing our cash flow, our revenue, or our budget for the next and upcoming years, we need to think about what is our ability to provide this healthcare service in certain areas of this organization. So the first thing we're going to do is we're going to have to be utilize common sizing, which is we're going to convert the availability in certain areas of the organization into percentages. So, for example, the percentage of patients to nurses or the percent of patients to healthcare providers. So, this is important. We'll turn that just like we would in the budget or turning in dollars amount into percentages. We also can do the same thing when it comes to the availability of staff or even supplies, or we need so many beds for so many patients. So this all can be converted into percentages, and this is what common sizing will do. So we'll be able to better project in the future, how much we're going to need to increase in staff or supplies, which eventually, will, of course, will affect our revenue and our budget, and how much we're going to be spending in the future based off of our capacity. And trend analysis is pretty much the same thing, but it would reveal the effectiveness of the current and past availability. So we can go back and look and say, okay, what were we utilizing in the previous years? Normally we had, so I'll use my laboratory as an example. If we had one lab technician or two lab technician, how many patients were those, how many patients were being seen on average per day? And what were the, you'd have to look at a lot of information, just like before. You couldn't just look at the fact, or you had to look at turnaround times, how fast was the patients or the providers getting the results. So that would have to be implemented into that as well. And you take all that information and look to see what is the most effective. What is our goal? Do we want to get to uh, providers being able to receive their results in then 20 minutes? Well, then we probably need to add additional staffing, or maybe additional chairs for patients to be drawn. There's a lot of aspects to go into that. But for example, like I said, you can go back to previous years and see how effective is the current um, availability or the effectiveness of the current and past availability in relation to the number of patients of need and care, or is the adequate care being provided based off of our previous analysis? And so we might have to adjust that in the future. So, in conclusion, the first thing to remember about creating a budget analysis or cost analysis for the future, and looking at those cash flow and everything, is that no one can predict the future. Uh, and most of the time, budgets and stuff are based off of assumptions. So we're not going to be predicting. So we can kind of look at it, but the more information that we have available to us, the better our assumptions will be. But our assumptions, most people think of assumptions as something, well, I'll assume. But most of the time, assumptions are made off of previous actions. So, as long as we have the right data and utilize the resources that we have to make the best decisions, then we will have a sound, um, we'll have a organization that has a growth, a financial growth and stability. So that is just necessary to be able to grow in your organization financially. And most of all, you want that stability. And in order to do that, you have to make those assumptions and those future projections based off of evidence. Just like I said here, you're going to do it based off of reliable sources, not just, something somebody says or one area or one department. You have to take all the information, gather it, and see what's most likely for your organization. Thank you, and have a good evening. And these are my references.